Sure. I want to talk a little bit, though, however, about clinical guidance for all our practitioners, of course, their support staff, to prevent and treat monkeypox, because I would say many clinicians, maybe a majority of clinicians, have not directly treated monkeypox and may have not seen a wide range of cases, so it's critical for clear guidance to be widely available to all medical professionals, and I would also say their support staff who do answer the phones, take the questions in the room when they're doing their own histories and physicals. It's important for treatment and prevention. And so regarding monkeypox prevention, I have concerns about not just the slow rollout of vaccines to vulnerable populations, and I appreciate that you have been doing significant work to make the vaccines more available, but with all these vaccines rolling out, there's a new COVID vaccine, it's a flu vaccine, there's a pneumonia, there's a shingles, of course, then there's other things that people might get, tetanus, this or that, for adults. I'm talking about adult population. It's a lot of confusion about boosters. Can I combine vaccines? And so I'm really, really concerned that the CDC, Dr. Walensky, what are you doing to mount this public information campaign on the wide variety of vaccines, important ones, available? We don't want someone to maybe not get a shingles. My parents both had it. It's very painful. How are we going to do that? At pharmacies and public spaces, even besides our doctors, people may not be going to a doctor or clinic, but maybe they're going into their local drugstore or grocery store every week, right?
Yeah, so thank you, Senator, for that important question. And I think one of the things you raise is one of the challenges that we've seen, first with COVID, now with monkeypox, and one of the places I would really welcome Congress's help. We don't have a mechanism in this country by which we inform all clinicians of a new outbreak or a new disease. So this has been through a lot of public education. We've had a massive amount of outreach. We have health advisory networks that we reach out to. When we put out a health advisory, and we've done 4 for monkeypox, they reach about 1 million clinicians. We've done what we call clinician outreach webinars and calls, COCA calls. They reach about 6,000 clinicians. We put them online. They reach about another 10,000 each one that we do. We've done several of those. I personally have sent a letter to all boarded clinicians through the AAMC, working with each state to try and send letters out to inform people of a disease that they may have never heard of and may have never seen, but tomorrow might walk into their clinic. So what do they need to know? What are the protections that they need to take? And how would they diagnose, treat, and care for a patient with this infection? So that has been a lot of the work that we've had to do during this outbreak. I will say from a health worker safety standpoint, at least as far as monkeypox is concerned, we've seen very little outbreak in healthcare workers. We have had 1 diagnosed healthcare worker after a needle stick injury, but we have seen very little healthcare worker outbreak due to our personal protective equipment and the outreach that we've done in telling healthcare workers how to protect themselves.
But what about the broader idea of that we have this fall so many vaccines that are available, we'll just say to the adult population, preventative vaccines that we normally have, flu, shingles, pneumonia, for a few of those, now a COVID booster, now potentially a monkeypox shot. How are you going to just get this out to patients, consumers, people in general?
So we do a lot of provider calls for that as well, our advisory committee on immunization.
What if you're not going to provider? How are you going to get it to the average person?
Well, so we've been doing we've been doing press conferences, we've been doing advisories. As we've rolled out both the bivalent booster, we have a massive flu campaign that we roll out in early October, which we will again do this year. One important thing I want to just highlight, though, is that we at CDC and we in this country do not have a mechanism like we do with children. You listed adult vaccines. I believe there are 13 of them that are advised. Adult vaccines, we do not have a mechanism in this country to finance adult vaccines the way we do vaccines for children's program. Mm-hmm. So when we look at the equity of getting vaccines to rural populations, to other populations, we do not have a mechanism by which to do that in an equitable fashion the way we do for children. That is a big constraint that we have right now.
Thank you. I know I only have 20 seconds left, but Dr. Fauci, I just want to ask you quickly, we have monkeypox, so medication to treat the infection, but there's symptom management. We hear a lot of talk about opioids. I know it's very painful, monkeypox. I don't know what the treatment might be, but what kind of guidance are you giving the medical community about effective pain management as it relates to the neuropathy, I would imagine, that monkeypox causes?
There are medications for the neuropathy, but importantly, particularly when it's on the mucosal surface, be it the anal, rectal, mucosal, or the urethral mucosa, that can be extraordinarily painful. We recommend, and the hospitals do this anyway, I think that's pretty common knowledge, it is an acute, not a chronic pain. So it's the kind of thing that you would not hold back on any type of pain medication just because you're concerned about addiction. The discussion that we've been having about fentanyl and the opioids is not using it for chronic pain. This is not chronic pain. This is very acute pain that usually resolves itself within a period of a couple of weeks, but you certainly don't want your patient to suffer inordinately by holding back pain medications.
Similar to that pain of shingles in that same way. Thank you. My time's expired. Thank